Good morning. This is Dr. Timothy Scott Beck at LifePoint Medical. It is December the 19th of 2022. I want to say good day to you. Good Monday. Merry Christmas. I know Merry Christmas is this week. So first thing I want to do is tell you what our schedules are going to be this week. This week we're going to be open like normal, Monday through Friday. Next week we're going to be closed on Monday, and then we're going to be closed on Friday. And then we'll open up the following Monday and start the new year off ready to go. Okay, so we do ask that you, if you're having medical issues or you think you're going to have medical issues, to come on in and get seen prior to the last minute. However, we do have providers that will be working all week to catch anything on Friday that needs to be taken care of. The next thing I want to talk about is, I know some or all of you have received text messages from a company called AccuHealth, and that is something that I'm participating in. It is a Medicare program that we're kind of behind on implementing, and it's a next level of care that they want us to implement for my patients. I'm not against it. I'm actually for it. It is going to allow us to monitor patients a little bit closer than what we have and give you that customized care that you need. Plus, we can use these as instruments, tools to keep you out of the hospital, keep you safe, hopefully keep you off meds, and to look and take care of problems before they become overwhelming or too bad. So that's called remote patient monitoring. The company is called AccuHealth. Now, I have to say, when they first started this, they were calling people or talking to patients, and they had very strong accents, and they said they were calling from my office, and then almost 100% of the people said Dr. Beck doesn't have somebody that talks like that in his office. And so they are in a remote location, and they have more doctors than just me that they're servicing. And it's a huge nursing call center is where this is going to be centered around. And so when we sign you up for RPM, and what RPM does is it takes a variable that you have that needs oversight, and the three that we're doing are blood sugar, blood pressure, and weight. And so any one of these variables, or all three, will send you equipment to use that the equipment, through technology, anytime you check your blood pressure, your blood sugar stuff, is going to be sent to this call center where these nurses have perimeters set up, and they do this 24/7. And anytime they fall out of the perimeters of what I have set forth for you, it will give me a call and say, hey, you have a patient whose blood sugar is reading out at 300 or 400, or they've gained a bunch of weight, or they lost a bunch of weight, or their blood pressure's reading out dangerously high, something like that. Then they'll let us know, and then we will respond accordingly. So that's called remote patient monitoring. You will have these people contacting you. We do bill for this. Medicare has it set up a certain way we bill it. It's much like chronic care management, and these chronic care management and remote patient monitoring are supposed to work together, not separately. They work together. Again, I want to reiterate, I did not come up with this idea. I'm on board with it. I'm late to the show, but I think it's a good idea, and I think it's going to help me, and it's going to benefit you too.